So Liz, can you, in your words, explain dynamic assessment?
Assessment is a process where we use a test, teach, and retest approach to try to figure out whether there's a language difference or a language disorder. So lots of times in standardized testing, children will score low, not because they have an impairment, but because they don't have the knowledge base or they haven't had the experience in that area to do well. So that score is kind of a starting point for a dynamic assessment. After we do the baseline testing, then we develop a short intervention based on Feuerstein's principles of mediated learning experience, where we talk to kids about what they're going to learn, why they're going to learn it, and help them figure out their own strategies for learning and for incorporating what we're trying to teach into their daily language. And then after we observe them during that short-term learning session, maybe 30 minutes or 2 30-minute sessions is what we usually do, but you can tell after 30 minutes, we look to see how well they learned in that session. And we do that 2 ways. We do a post-test and look to see whether they improve from pre-test to post-test. The other thing that we do that is actually the more informative and powerful thing is we look at how responsive they are during the intervention. So there's kids who pick it up right away as soon as you say, okay, so how would you think about this thing, or how could you incorporate these ideas into the story that you told, and they just get it and it just comes together for them. Those are kids who have normal development probably, or normal abilities, but just didn't know how to do whatever it was. We do this with storytelling, for example. So in storytelling, maybe they left out major parts, but you talk to them about what stories need to have in them, and they pick up on that and incorporate everything that they need. Those are kids who it's maybe a lack of experience, not a lack of ability. And children who persist in having difficulties, who have difficulty attending and self-regulating, those are children who probably have language-based impairments and would probably benefit from some intervention.